Progresa, Oportunidades is the principal anti-poverty program of the Mexican government. They focus on helping poor families in rural and urban communities invest in human capital, improving the education, health, and nutrition of their children, leading to the long-term improvement of their economic future and the consequent reduction of poverty in Mexico. Oportunidades' vision. Poor families are aware of the benefits of investing in their children but cannot afford the monetary costs of attending school or the opportunity costs of sending children to school. So, Oportunidades is to provide parents the equivalent of that income to send their children to school instead. Some of these benefits are provided conditionally on children's regular school and health clinic attendance, and so programs of this kind are commonly called conditional cash transfer (CCT) programs. In effect, low-income parents are paid to send their children to school. The benefits: such payments work to increase school enrollments, attendance, progress through grades, other schooling outcomes, and nutrition and health. Before the program, Mexico operated a maze of inefficiently run food subsidy programs managed by as many. For example, urban poor get benefit more than rural poor, and educational achievements and health gains failed to reach the poor in the way they had benefited the better off in Mexico. For economic reasons, many poor children had to work rather than go to school. But poor health and education as a child are major determinants of lifelong poverty. Progresa, Oportunidades, an innovative developing country-designed integrated poverty program. Its major architect was Santiago Levy, a development economist who led the design and implementation of the program in the 1990s while serving as Deputy Minister of Finance. From its inception in rural areas in August 1997, the Progresa program had grown to benefit some 5.8 million rural and urban households by 2012 Government of Mexico website data. Progresa, Oportunidades affects child nutrition through 4 program components called pathways, cash transfers, which may be used in part for improved nutrition, nutritional supplements given to all participating children under the age of 2, pregnant and breastfeeding mothers, and children between the ages of 2 and 5. Participating families receive school program payments every other month. Payments are generally provided through the mother. The payments are supplied via a bank card, directly from the federal government. Progresa, Oportunidades gives an incentive to keep children in school longer and helps the children continue into higher grades. Families of girls also receive slightly higher payments than boys, partly because girls are more likely to drop out. Progresa, Oportunidades has a larger impact on enrollment and performance per dollar spent than building new schools. The budget for even the much expanded Progresa program in 2005 was still some $2.8 billion, fairly modest, even in Mexico's economy. This represented less than 0.4% of gross national income. Only Mexico's pension, Social Security, system is a larger social program. Progresa is also organizationally efficient, with operating expenses of only about 6% of total outlays. This it owes in part to the direct provision of cash grants via bank cards to the beneficiaries, bypassing the sometimes ineffective and potentially corrupt administrative bureaucracy. Fully 82% goes to the direct cash transfers, and the remaining 12% goes to nutritional supplements and other in-kind transfers. Some additional costs for provision of healthcare and schooling are borne by the Mexican Health and Education Ministries. Evaluations of Progresa indicate that its integrated approach has been highly successful, with large improvements in the well-being of participants. Malnutrition has measurably declined. Family use of healthcare, including prenatal care, has increased, and child health indicators have improved. School attendance is up significantly, and the dropout rate has declined substantially, especially in the so-called transition grades 6 through 9, when children either get launched toward high school or drop out. The lessons of Progresa, Oportunidades are spreading throughout Latin America, and some of its features are also found in the Bolsa Familia program in Brazil. Familias por la Inclusión Social in Argentina, Chile, Solidario, Familias en Acción in Colombia, Superimonos in Costa Rica, Bono de Desarrollo Humano in Ecuador, Programa de Asignación Familiar in Honduras, Programa de Avance Mediante la Salud y la Educación in Nicaragua, Red de Oportunidades in Panama, and Proyecto 300 in Uruguay. By 2010, Progresa had been replicated in whole or in part in 29 countries. Although the cost of a CCT program like Progresa, Oportunidades may be manageable in middle to upper middle income countries, in low income countries, outside financial assistance is needed, both for the payments themselves and to increase the number and quality of clinics and schools to be availed of in the program. Poverty reduction still requires complementary improvements, such as better roads to poor areas, public health investments, and local empowerment. CCT programs focusing on improving health, nutrition, and education are a key component of a successful policy to end poverty. In Mexico, as in other countries, the broader package includes development of infrastructure so the poor can get their products to market and get access to safe water and electricity. It also includes integrated rural development programs along with provision of credit and some temporary employment programs. But by building the human capital of the poor, the program provides the essential foundation for the poor to increase their capabilities and take advantage of opportunities as the economy grows. It thereby also enhances the prospects for Mexico's own growth and development. The Progresa, Oportunidades program is a model of success in many ways and offers a model for providing health and educational progress for poor families and opportunities for their permanent escape from poverty.